One of them they listed was someone who died several years ago, and so couldn't be writing anything now.
Let's talk about the elephant in the room, the AI tool.
Often things from AI, they seem credible, but once you get into them, it's made up.
They can post 10,000 comments in few seconds.
Whereas if it just appears, let's say, on TikTok, you don't know.
X amount of time in sun will definitely give you skin cancer. But then when you dig deeper, the study is done on mice and they are hairless.
You found that people who eat blueberries live longer, but maybe it's not the blueberries.
Yes, and if you work for a large pharma company, there's always a conflict of interest.
The people who did this study are consultants to the drug company, and so they might be biased.
There's a lot of these predatory journals because their whole business model is making it look credible.
Right. In terms of credible journals, one way to look at it is
Today on Medical Centric, we have Dr. Barbara Gastel. Doctor, how are you today?
I'm doing just fine. How about you?
I'm doing really well. For our listeners who are not professional writers, how would you describe in simple terms what you do?
Right. I'm a professor at Texas A&M University. My specialty is medical writing and scientific writing and science writing. My background, I'm an MD and I have a master's degree in public health also. And I've always been really interested in writing and editing and also in medicine and science. And so at Texas A&M University, I have joint appointments in our College of Veterinary Medicine and Biomedical Sciences and our College of Medicine, and I direct our master's degree program in Science and Technology Journalism, and I teach various courses in writing scientific papers, courses in writing about science for the public, courses in science editing, and so forth. And I also teach at our medical school, largely teaching sort of medical humanities, writing about medicine, and so forth. So that's basically what I do.
Awesome. That's very helpful. Our audience is not medical professionals, right? So I'm trying to tailor the episode towards an average individual that just wants to live a healthy life, right? Can you help us understand why it's important for somebody like me to understand how these medical journals and publications are written and what goes behind the scene?
Right. Thank you. I think it's useful to know what goes beyond medical for publications because as a member of the public, I need to judge, well, what's good medical information and what isn't. And so at good medical journals, the content is very carefully reviewed. If someone, let's say a researcher, writes a medical article, it is sent to the journal and the journal editors look it over, but they also send it to other experts in the same field. Process is known as peer review. And the other experts will judge the content. And then based on that, the journal will decide whether to publish the article. So let's say, if something is coming from a good medical journal, let's say it's coming from the Journal of the American Medical Association or the British Medical Journal, people can feel this has been vetted, it's solid information. Whereas if it just appears, let's say, on TikTok, you don't know, is this, good, solid information.
Benchmark as to how many other experts need to review it before it becomes credible? Or is it more of each case is different and it depends on how many experts are in the field?
Great question. Often different journals have different norms. Commonly, it's about 2 or 3, but sometimes it depends on the subject matter too. Because, for example, if it's an interdisciplinary article and it should be judged from many viewpoints, then there might be several. So let's say it's an article about infectious disease epidemiology, about the spread of disease. So they might have an infectious disease expert review it, and an epidemiologist review it, and a statistician, and then maybe someone, a more general doctor looking at it. So it often depends, but commonly for a medical article, it's about three different, they try to have about three different experts looking at it.
And, I'm going to apologize before the question, because a lot of these questions might sound very lame or, base level, but that's really because our audience is not medical professionals, right? So I'm really trying to understand the process. If, somebody submits article or a thesis to a medical journal, what is in it for the other experts to review it? Are they getting paid? Are they simply doing it for the betterment of science and humanity?
No, good question. Usually it's done as a service, but it's a reciprocal service. It's back and forth because usually these experts are people who themselves write articles and need them peer reviewed. So the thought is, if I'm a member of the medical research community, I expect my articles to be well peer reviewed, but in return for the system to work, I have to review some other people's articles too.
If you never
Right. And sometimes there are some small rewards. Usually the peer reviewers aren't paid, but sometimes there will be, for example, other benefits. They may get some certificates or discounts. For example, let's say if it's a um, an online journal with subscriptions, they may say, well, in return, you can, for let's say the next 6 months, have free access to the journal if you're our peer reviewer. Or, or if many journals have a fee to publish to help cover the costs of the journal. So they may say, if you're a peer reviewer, you can get a discount on getting your own material published. Also, I think in terms of recognition, I know there is a journal that I have sometimes reviewed for, and they are a major journal. They're very careful about their peer reviewers. They keep a database. They actually evaluate their peer reviewers to see whether they want to invite them back. And what they do is every year, they look at their database and see who their really good peer reviewers are. And at the end of the year, their best peer reviewers get a letter of recognition, and they are encouraged, for example, to share that letter with their supervisors.
Right. You were practicing. So I guess my question is, from the world of clinical medicine and public health, what drew you into science of writing, editing, and communication?
Yes, thank you. Actually, I went straight from medical school and public health school to this. So I had some clinical experience in medical school, but I was never out in the community practicing. And I guess I had always been trying to decide between a career as a writer and editor or a career as in medicine or public health. And then I realized I could put the two together. When I was in medical school, I worked on a medical journal, and I really liked that very much and felt that by going into medical writing and editing, I could pursue both of my interests and still be of public service.
Oh, that's brilliant. That's a really good combination. Are there common myths or frustrations that people, when reading online or, reading medical health information online, are running into?
Right. Let me think. Any myths? Well, I know one. Let me mention one of the myths. I think one of the myths is that, like, scientific findings are permanent and true, and so people will get upset. For example, one study will, come to one conclusion and another will come to another conclusion. And they say, well, you can't trust science. But I think scientific research progresses. And so, a study comes out today. That's the best evidence we have today. But then there may be some more studies, maybe bigger studies or better studies or longer studies, and they get more evidence. And then based on the having more evidence, there's a different conclusion. And it's not that science isn't working, it's that it's learning more and more. So there may be different conclusions at different stages.
Right. And, obviously things change, new data comes in, right? So more information is obviously better. My next question is towards the line of, who decides what to write on? So I understand if you have time and a degree and you can choose anything you want to write on, but is there a way to see issues that are publicly more important? For example, vaccines is a very controversial subject. Is there incentive or disincentive to publish on that, or is it really at the mercy of medical professionals and them picking up a topic or not?
Let me answer this on two levels. One, the level of, let's say, a medical journal. The other will be of, let's say, writing for the public in, let's say, a newspaper or in broadcast. Or for writing by medical professionals, there's writing about new research, and research costs money. So normally people need grants to do money, this funding usually from the government or private foundations. So they will have proposals or grant applications and propose what they're going to do research on. And again, this will go through peer review. And so there'll be groups of experts who will look at it and look at both, is this an important topic and is this research well designed? Because if it's not well designed, it's not worth doing the research. So they will judge the research, and then if the research is approved, then people will do the research and write it up. So that will be for research articles. Medical journals, in addition to research articles, sometimes have things like editorials or other pieces. And that may be something that either the doctor or scientist proposes, or the editors may say, let's take a veterinary medicine example. At the time we're recording this, New World screwworm has become a problem again. And so let's say I'm the editor of a veterinary journal. I may say, this is a very timely topic, or so-and-so is a world expert on it. Let's have Dr. So-and-so write an article about it. So sometimes the journal will, in the popular media, let's say newspapers, magazines, radio, and so forth, again, sometimes the idea comes from the writer or journalist, and they'll propose it, and the editor will decide whether to do it. Other times it may be, for example, the newspaper editor or the magazine editor may say that again, right now there is, as we record it, there's an outbreak of Ebola. So they may say, this happened actually with one of my students who's an intern at a publication, and he has a good science background. And they said, well, Ebola is a current problem. Please write an article about Ebola. So so both for journals and for popular media, the idea may come from the person who's writing, or it may come from an editor who suggests it.
Can you think of a real world example where unclear or clear communication in medical field made a big difference on how it was perceived?
I'm not sure if this is the same kind of thing, but certainly in medicine, oral communication or other communication with patients is extremely important. And certainly, I think all of us in this field um, know of instances where, let's say, there was not good communication by the doctor or other medical professional, and therefore the patient either didn't follow instructions or misinterpreted the instructions and maybe didn't take a medication they should have or took the wrong dose or other things, or the patient just was so frustrated and confused they didn't follow through. um, I, I think certainly in communication directly with patients, that is. And then I, I'm not sure I can think of specific examples, but I've certainly, seen situations or heard situations where members of the public were discussing something. It's clear that what they had read or what they had heard in the broadcast media had been misinterpreted.
Mm. Well, we're now living in this world where everything is consumed in short bits, right? Like you have your reels and shorts and TikTok videos where the consumer really want information in 60 seconds, 90 seconds. Has that changed the way the medical industry or the medicine journalists are publishing their journals?
I think so, but let me mention, I think it's sort of bimodal that, for, sort of members of the public, many members of the public, they want things in 30 or 60 sections. But there's also been a resurgence of long form journalism, and that many people, enjoy long magazine articles, and there's good consumption. But I think both in the popular media and, let's say, in public health communication by the government, they're realizing that many people want things in short bites. So there's also providing, in social media or elsewhere, material in short bites or combinations of things. There may be long form stories, but accompanying, snippets and so forth. So I think there.
I didn't mean to interrupt you. I was just going to say, I've seen a lot of short clips where they say a new study comes in and then they tell about the study in 60 seconds, but then they will attach like a PDF saying, if you want to read the full study, here's a 10-page document.
There may be, the 30 or 60-second clip. There may be the news story that may be a 2-minute read, and then there may be, the full journal article. So I think often, a really good strategy is sort of layering things. And so having the short material that can draw people in and that's been, carefully vetted to make sure the conclusions are correct. But then for people who want to know more, who want to evaluate, the quality of the research or the broad applicability of the research, I think it's really important to have more information available too.
Let's talk about the elephant in the room, the AI tools. That one is scary because AI can, without any medical background, write a 100-page article that will sound and look and read very professionally. Is that causing a problem in the industry, or what is going on there?
Right. Yeah. So with AI, can write some things that seem credible. I think it can be sometimes an aid to writing, but we've got back to peer review or other review. Things have to be checked carefully because often things from AI, they seem credible, but once you get into them, it's made up. And so there will often be a mix of good information and bad. I have an example from the other night. I have a new book out on medical editing, and I wanted to look into, well, what kind of book reviews have there been of it? And I've seen some book reviews, and I thought, well, maybe I've ignored some. So I went into an AI tool and I asked about, well, what book reviews have there been? And the AI produced a very credible looking little report. However, when I actually looked at it, I noticed that there were a number of things wrong. He listed as some of the reviews, or all of them, for the dates listed, they were before the book came out, so they couldn't have been. The other thing, one of the authors of the review of the proposed reviews that they listed, on the surface they seemed credible because were people in the right field. However, one of them they listed was someone who died several years ago, and so couldn't be writing anything now. So I think what AI can really be a good tool, but it really has to be checked carefully. I think in terms of information, also in terms of voice. I think very often, the AI will have sort of a distinctive, very uniform voice. It's not really a human voice. And for writing, particularly writing for the public, it's sort of the human voice with the distinctiveness and the variations that makes it good reading, makes it interesting reading.
I'm just worried it's gonna pollute the noise so much that an average person is going to have a really hard time telling what's real. Like, you have been doing this professionally. When you read an article, you can tell if this is written by an MD or an AI, right? But I don't think everybody can. And the AI tools are going to get better, and it's going to pollute because they have speed. They can post 10,000 comments in few seconds. No humans can ever compete with that. Does that ever bother you, that what's coming in the future?
I think, it does. I think, again, going back to peer review, I think checking that things are from peer reviewed journals. Journals do have specific policies regarding AI and again, things have to go through peer review, and the journals often have policies as to what AI can be used for and what it can't be used for the journal. So they may say it cannot be used for drafting your article, but it can be used to help search the background literature, or it may be used to help improve the grammar, something like that. So, but that is in the journal editing field, that is a big area of discussion. In fact, later today, I have a meeting. I have a colleague who is proposing some research relating to use of AI in journals and what journal editors think is appropriate. And they've asked me to be on the research team. So it's a big area in the field, and something that.
Well, let's talk about your craft. What does medical editing actually involve? What are some key skills that you teach that anyone can apply to improve how they read or write something?
So let me mention, editing is often on a couple of levels. There's the level of sort of the mechanical, like the spelling and grammar and punctuation, making sure that all of those are correct, and making sure it's, for example, in the right style and format for, the particular journal or newspaper. So that's sort of the surface level. But there is also the deeper level, a level sometimes called substantive editing. And actually, I teach an online course for the University of Chicago certificate program about that. And this deeper level is, for example, does the article include all the types of information it should? Or is some important information missing that you should ask the author? Or does it have some things it shouldn't have that should go out? Is everything well organized? Is it in the proper format? Also, is the logic, is the reasoning good? As an example of bad reasoning in an article is sometimes people find a correlation. They find that, oh, there's this association of this and this, and they assume that it's a causal relationship, but maybe it isn't a causal relationship. So as a substantive editor, I might say, yes, in your study, you found that people who eat blueberries live longer, but you're concluding that eating blueberries makes you live longer. But maybe it's not the blueberries. Maybe it's because people who eat blueberries are just people with a generally more healthful lifestyle, and it's not the blueberries. So I think in substantive editing, looking at, is it the right content, and is everything, well thought out? Even looking at the ethic, for example, looking at conflict of interest, is that indicated? Let's say it's a study that concludes that a certain new medication is better than the old medications for that. But it turns out that the people who did this study are consultants to the drug company. And so they might be biased. That doesn't mean that the study shouldn't be published. It may be a good study, but let's say if I'm doing a newspaper article about it, it should be mentioned that these people have an association and a possible bias.
Do you think any of this information can be used by someone like me or an average person in, making their reading or writing of their own health records better?
Right. I'm trying to think of your own health records or things like that. Certainly, if you are looking for good information, looking at these things, looking at, well, who did this study? Was it published in a credible journal? Another thing is looking at the study. Let's say if someone's trying to decide about something about their health, was a study done in people like you? Was it a mouse study? And sometimes mice studies end up applying to people, sometimes not. Or I sometimes use the example, I have an uncle in his 90s and with some medical problems. And so if I'm looking for studies of, let's say, the proper treatment of this medical problem, is it a study in other older adults that would be applied? Or is this a study in, college students who might be quite different? So maybe the findings wouldn't apply so much to my uncle.
Yeah, you gotta see your age group or certain demographics they are looking at. I think I had a dermatologist on the show a little while ago, and they were mentioning how there's a study that says X amount of time in sun will definitely give you skin cancer, right? There's a study, but then when you dig deeper, the study is done on mice, and they are hairless mice, and they have absolutely zero hair. But we as humans have hair, and it's not the same when you're under the sun and mice is, right? So that's kind of an important distinction to know. Very helpful. I'm trying to think of an example where this could come in, but I think it'll come to me in a minute, because I had an interesting thought here. There's a lot of these predatory journals, right? And for an average person, it's very hard to differentiate, because their whole business model is making it look credible. How does one go about finding credible journals versus things that we know are fake but they look really credible?
Right. In terms of credible journals, one way to look at it is in the United States, there is something called PubMed, and you can search for pubmed.gov. And this is a list of many, many credible journals. These are journals that if you look in PubMed, you can do a search for the articles in the journals. So if a journal is listed in PubMed, they vet journals very carefully. So chances are extremely, extremely, extremely strong that it is a solid journal. So I would say PubMed. Also, librarians are a wonderful resource, and I think an underutilized resource. Librarians no longer are just people who shelve the books. They're information searching experts. So if you have a public library, or if you're at a university or a company that has a library, if you're not sure if something's a solid journal, you can consult a librarian, and a librarian can help find out too, or even see if the library has that journal. Again, the librarians would check whether it's a solid journal. So those are some ways to try to find out. I should say, as a caveat, PubMed lists many, many journals, but there are some good journals, medical journals, that are not listed for one reason or another. For example, PubMed is largely American and other Western journals. So there are journals in some countries that may not be listed, things like that. So, I would say, if it's in PubMed, if you can feel pretty solid, it's a good journal. If it's not in PubMed, it still might be a good journal. It might just not be included. But then I think need to check more carefully into it.
You've been doing this for a very long time. Are there things that you wish you knew earlier when it comes to teaching and editing?
Let's see. I'm trying to think of, in terms of teaching and editing, some of the things I wish I had known earlier. I think maybe sort of more a sense of what is important in editing and teaching. And really, I think that the most important things in writing are good content and good organization and clarity. I think often, if someone's beginning to teach writing, and I think this was my case, is thinking, well, the important thing is making sure all the grammar is perfect and things like that. And that's important too. But if the content and organization and clarity aren't there, it doesn't matter how good the grammar is.
Right. Yeah. I mean, the grammar is important, but it can't be primary, right? If the content is bad, of course. Can we talk about your book? Because that's how we connected. Can you tell our listeners about the book that you recently wrote?
Right. Maybe I should mention two books. The most recent one is a book on medical editing. It's from the University of Chicago Press, and it's aimed mainly at people who are thinking of becoming medical editors, or who are early in their career and still learning a lot about the field. Although people have said, and I'm glad they say, that it has some things for more advanced medical editors. So it talks about both doing a career in the field, and then, as we were talking about earlier, talks about how to do copy editing, let's say editing, the grammar and spelling, punctuation, but also substantive editing, editing for content and organization and logic and so forth. And it talks about ethical issues in editing and helping guide authors regarding ethic. And it also talks specifically about how to edit certain kinds of articles, let's say research reports or case reports or news articles. So that's for that book. The other book is a book called How to Write and Publish a Scientific Paper. It's published in the United States by Greenwood Press, and then available in Europe and some other places through Cambridge University Press. There also have been some translations to other languages other than English, published by publishers in other countries. And this is a book mainly on writing journal articles. It's a book I sort of took over as first author. My co-author, Robert Day, he wrote the first 5 editions all himself, and then he retired. So he wanted someone else to come on. And so the recent editions, I'm the lead author. And this gives researchers, and especially, let's say, graduate students, postgraduate students, being researchers, guidance on how to write a paper, what goes in each section, how to do the English and so forth. And then the process of medical journals and scientific journals, how things get published. For example, we were talking about peer review, how peer review works. The book has been broadened out to talk about some other aspects of communicating science. So, for example, there's a chapter on writing grant proposals. There are some chapters on giving presentations and some things on writing for the public. So it's now a more general book on communicating science, and aimed largely at researchers, either scientific researchers or, for example, physicians who do research.
I want to touch on the career focus, meaning science communication careers are very rewarding, but often they're considered low paying. Is that hurting the cause where people don't want to be doing this because there isn't really a lot of money?
I would say I would call them moderate paying. I mean, they're not super low paying. I mean, but one can have, get a solid income. You're not going to get rich normally as a medical writer or medical editor. But let's say if someone's a medical writer or editor at a university or a government agency or a journal, it's a good solid living. The in general, the best paying jobs are in industry. I know some of my colleagues who are writers or editors at pharmaceutical companies or biotechnology companies. They tend to have higher salaries. Again, not super high, but quite good salaries. So I think, a medical writer or editor is not going to be destitute. Actually, you are ethically required to report side effects and things. So there are very stringent requirements. Let's say if you are, for example, as a medical writer or editor, you may be working on reports that have to be submitted to the government, for the government to decide whether to approve a drug. And there are very stringent reporting requirements. There are also, let's say you're working on material for the public and you work for a company. There are both ethical requirements and, at least in the United States, laws as to, what you can say and what you can't say. So the you are required to be truthful and balanced. Right, yeah. So the books are on Amazon and available from the publishers. This social medium I use the most is LinkedIn, and I try to post at least about once a week on LinkedIn. Occasionally it's about things I'm doing. For example, last week I gave a webinar on is sort of overcoming writer's block, on sort of getting going and keeping going in writing. And I had a post about that. And I said that if people wanted my slides, they could get my slides. Very often in my posts, I will feature work by other people. I'll mention resources that I think are good and provide links or tell people how that. So I would say probably the best way to follow what I'm doing is on LinkedIn, and people should feel free to message me on LinkedIn, and I'm glad to reply. I've really enjoyed our conversation. Thank you so much for inviting me.